I'm Candace from Orange County NORML. Thanks for joining us today.
And I'm David with Orange County NORML, here to present the latest and greatest, most exciting news in the cannabis freedom fight.
Tonight we start you off with a great interview with Dr. Fichtner.
Dr. Fichtner, thank you very much for coming on our show today.
Pleasure to be here.
Really enjoyed reading your book. It's amazing. A lot of scientific data on the book. What was your initial inspiration for putting all your thoughts and your experience together in this book?
Well, as you know, Dave, my background is I'm a psychiatrist, and for a good part of my career, which I started in the VA working with patients with post-traumatic stress disorder, for a good part of my career I've done administrative work. It wasn't long till in the VA I became a chief of service, which meant I had responsibility for organizing programs. And then I went on to the state of Illinois, where I worked for 7 years as the chief psychiatrist for the state hospital system. And then after that I spent a couple years as the director of mental health. And as I went sort of further up the ladder in these administrative positions where we had increasing responsibility for program development and evaluating how the public monies were spent in terms of creating programs for people with mental health problems. As I got further up the ladder, I grew to appreciate more and more from a kind of 60,000-foot view, not only the relationship between mental health and substance use problems. For example, in jails, many times we'll find many people who've been arrested for substance use, or whether it's possession or involvement with drugs in one way or another, and many of those persons will also have mental illnesses. Likewise, in our public clinics and hospitals, many of the persons with mental illnesses also have substance abuse, and that's usually seen as a reason to work that much harder to provide treatment and to deal with both supply and demand issues involved in drug abuse. But as I took a look at the system even more closely, I realized that yes, we do need more funds for treatment of substance abuse problems. Certainly we need more treatment rather than incarceration. But there's also a very substantial tier, you might call it, a tier or layer of substance abuse problems that are only there because we create them. And I think that the use of cannabis is a good example of that. I discovered when I looked at the data in Illinois in 2003 that there were, even though there are not very many people in most state prisons for marijuana-related crimes, there are more in federal prisons, but in most state prisons there are not a lot of people in for marijuana-related crimes. Still, many people are arrested for possession of marijuana. And in Illinois, what I discovered was that arrests for marijuana accounted for more drug-related arrests than all other substances combined. That includes unauthorized possession of prescription meds. It includes heroin, cocaine, crack, all the psychedelics, methamphetamine and so forth. The number of arrests for possession of marijuana outnumbered all of those combined. And I think data like that began to, as I began to think about that, suggested to me that that was a very changing the way we manage cannabis in our society was a potentially high leverage intervention to change the outcome of people who would be introduced to the criminal justice system for that reason. And as I became more interested in drug policy, so my interest in this really evolved out of a larger interest in drug policy and the interface of drug policy issues, especially as they're dealt with in the criminal justice system and the mental health system. It really grew out more out of that interest than it did out of the medical interest per se. But being in the mental health director role, I had a lot of opportunity to talk to advocates and consumers with a variety of interests, and one of those advocacy groups were patients who were lobbying to gain access to cannabis for medicinal use in Illinois. So I began to listen to the stories of some of those patients, and they really challenged me to look at the literature, to say, dig a little more deeply into the history of how of what the status of cannabis has been, you know, in America. And I think that was the beginning of you know, educating myself about herbal cannabis from a perspective other than the notion that this is to be seen as a substance of abuse and nothing more.
Thank you. Now, you name book as Cannabinomics. Why that particular name for the book?
Well, cannabinomics, or either cannabinomics or cannabinomics, could be pronounced. Really just kind of hit me at one point as a term that worked for describing what I was trying to do, which was cannabinomics literally means the management of cannabis, and it's offered as an alternative to the use of words, to the use of language that has so many negative connotations for so many people. So I would say that rather than talk about marijuana policy, let's talk about the management of cannabis. And probably if I go back to sort of my own sort of awareness or my own awakening on this, I probably owe to Julie Falco from Illinois, who's an MS patient who has used herbal cannabis for the treatment of a broad range of multiple sclerosis symptoms. And she was very adamant when I first started listening to her and first started finding out, you know, the stories of those who were lobbying for access to, you know, to cannabis on a medicinal basis. She was very insistent, very adamant that, you know, she not be thought of as a marijuana user, certainly not as a pot smoker. She doesn't even smoke it at all, but she resented this sort of negative, even terms with racist origins in the use of marijuana, the negative connotations. So she insisted on talking about her use of herbal cannabis as a therapeutic substance that helped relax her muscles, relieve her pain, improve her bladder control. She generally, you know, functioned, walked better, felt stronger when she was using it. She slept well. It seemed to help her mood. And by using herbal cannabis, she was able to actually get off several other medications and did not need as many pain relievers as she had previously, especially the you know, Tylenols with codeine and other stronger opiate pain relievers. So Julie, I really owe the initial impetus to think carefully about, if you will, the political correctness of my language. Am I going to talk about marijuana? Am I going to talk about cannabis? And what I found as you begin to talk about herbal cannabis, people are a lot less offended by that than they are about the notion of marijuana. So I typically say, let's not talk about the legalization of marijuana, you know, by any means. Let's talk about herbal cannabis, and let's talk about the regulation and control of herbal cannabis. I think that's a much more productive conversation to have than as soon as you start talking about legalizing drugs, legalizing marijuana, everything becomes polarized. But when you talk about regulating herbal cannabis, which, let's face it, it's a substance for which there is a very high demand in the United States of America. When you start talking about managing it, cannabinomics, the management of cannabis, and regulating it, gaining the benefits, economic benefits of taxation. That's a conversation that's a much more productive conversation than let's talk about marijuana, whether it's medical use or legalization. As soon as you use the word marijuana, you've alienated or polarized the group, and some people are no longer listening to the conversation.
Thank you. Now, you mentioned tax and regulate. Do you have any particular opinions on the particular proposition on the California ballot?
Well, I'm delighted that the timing of my book is that it's here now, and we're looking at this coming up in November. I'd actually hoped to have the book written. Well, I felt it would be out about a year or a year and a half ago. So, you know, these things, I guess, tend to take longer than you think. But I